Hi, I'm Dr. Sarah Swasey with Herrera Psychology, and I had an opportunity to complete a pediatric wellness check-in and wanted to give you a brief overview of what that process looks like and what parents can expect from that process and what they will leave with. So prior to meeting with the clinician the day of the appointment, the parents are going to complete a thorough intake as well as a behavior rating scale that's going to look at the strengths of their child as well as any areas of difficulty that the child may be having. Then when the parents and the child arrive to the session, they will meet with the clinician. And during step one, which is about a 30-minute time period, they meet with the parents and the clinician is going to review over all of the intake information as well as the behavior rating scale with the parent. Depending on the age of the child, they may or may not be present during the time of step one. And if the child is older, they're going to be working on completing their own behavior rating scale during that time. From there, we move into step two, which is where the clinician gets the opportunity to interact with the child. And again, depending on the age of the child, the parents may or may not be present for that session. For the session that I completed, the parents were present, which provided a really great opportunity for me to model interaction with the child, as well as some specific skills and strategies for the parent, and they were able to see that interaction with their child. The therapist then will work with the child, perhaps playing some games, maybe having them draw a picture. I know that the child that I worked with had some fears, and so had him draw a picture of what makes him really happy and then what things are scary for him. And so we were able to talk about that during that interaction period. During step two, as we're engaging with the child, the clinician is also going to complete a strength-based interview so that they can really better understand the strengths of the child so that they can provide support and recommendations for interventions that are based on the child's strengths as well. Step three of the session is where the parents and the clinician will work together to create a prevention plan. What can the family do together as a family to help support this child and to provide a safe space for them and to continue to provide a safe space for them? We'll identify clear action steps to move forward. Parents will leave with a list of resources based on areas perhaps that were identified as weaknesses throughout the session. There'll be resources provided by the clinician that the parents can then utilize, as well as specific strategies targeting any areas of difficulty that the child might be having. We also want parents to know and be reassured that they are now part of our village at Herrera Psychology, that now they have an established connection with a clinician, and should anything additional arise in the future, they have a name and a face and somebody that they have built some rapport with to go to ask questions of. Parents will leave, as I said, with an abundance of resources that they can then utilize at home, books and websites and activities and strategies, all sorts of tools that are incredibly helpful as well. And again, it is our goal that you are part of our community and that we are available for any questions should they arise later on. So it's not as if once parents leave that 90-minute session that they're done and they don't have any support moving forward. They continue to have the support of Herrera Psychology for as long as they need. So hope this helps answer any questions about the pediatric wellness check-in, and we look forward to working with you and your children. Thank you.